Australians of all walks of life and of all political colours tend to be proud of the fact that in this country we have universal access to healthcare when we really need it. But there's a world of difference between having this as a principle and ensuring it is delivered in practice. Labor talks a lot about universal healthcare, but the dysfunctional way that they run hospitals, kowtow to unions, and their non-delivery of promises means that despite the in-principle entitlement to care, too many people are dying on waiting lists or queued in an ambulance waiting to get help in an overfull hospital, or they're languishing in a resort that's been commandeered to make for a makeshift ward. Labor talk a big game, but they just don't follow through. Ros Bates is the Shadow Health Minister in Queensland, and as a registered nurse and former hospital administrator, she knows what an effective health system looks like and what chaos and dysfunction does to patients in their hour of need. Ros, thanks very much for joining me tonight. You've been travelling the state, hearing from Queenslanders about the state of healthcare. What are they telling you?
Well, good evening, Amanda, and can I say that Queenslanders, no matter where they live, deserve a world-class health system. And make no mistake, Queensland Health was in trouble long before COVID. And that's why David Crisafulli and I, the opposition leader, are travelling the state. And in fact, by Monday, we will have done 32 health town halls from Cooktown to Coolangatta to Mount Isa. And unlike the Palaszczuk Labor government, who has given up on governing for Queensland, we are listening, and we have been doing these tours for the better part of the last 2.5 years. And what Queenslanders are telling us is tragic. We hear stories of patients having their loved ones die in their arms waiting for an ambulance. Patients who have had, who need to have total hip replacements, who are in such pain that it's bone on bone and they're in a wheelchair. Or patients that have been on the operating table for the 4th time and had their surgeries cancelled. So that's why we are doing the tours that we're doing. We are listening to Queenslanders, and we are acting on behalf of those relatives and patients who turn up as we do for the brave whistleblowers who attend our health town halls, the nurses, the doctors and the paramedics who have had enough of the Palaszczuk Labor government.
Ambulance ramping is at quite shocking levels in Queensland, and last week I was talking with the local member in the Redlands area, Mark Robinson. He told me it was over 60% in that district, but I think that's representative of how bad it is across the state. What do ramping rates mean for a person who needs emergency health care?
Well, Queensland has the worst ambulance ramping rate in the nation. Let me say that again. Queensland has the worst ramping in the nation at 43%. Logan Hospital, for instance, is at 67%. And what that means is those hardworking paramedics who didn't sign up to sit on the end of a ramp for 5.5 hours, it means that they cannot get to your loved ones. It means that if your father's having a heart attack or your mother's had a stroke or your child's having an asthma attack, you will be waiting longer for an ambulance, and that is just not good enough. The doctors and nurses are doing their utmost, and the only reason that ramping happens is because there is no room at the inn. There are no beds in our hospital, and this government spruiks a good game, but most of the beds that they're talking about now won't be coming online until 2027, and that is just not good enough, and it's too late.